Well, good afternoon, everyone. My name is Sally Cameron, and I am the Senior Law Reform Officer at Economic Justice Australia. I'd like to start by acknowledging the traditional owners of the lands on which we're meeting today, the lands of many Aboriginal and Torres Strait Islander people from across Australia. I'm living and working here on the lands of the Gubbi Gubbi people up in southeast Queensland, and I pay my respects to elders past and present. I'd also like to recognise and welcome any Aboriginal Torres Strait Islander people joining us today for this webinar. I think given the focus of the webinar, it's important to call out the history of social security and welfare in Australia, and that it has been used as a means of oppression and control of Aboriginal and Torres Strait Islander people. That is not all historic. Our members' casework continues to reveal social security policies and practices that disproportionately manage or lock Aboriginal and Torres Strait Islander people out of social security support. So that is something we're cognizant of as we, conduct our advocacy and work for a system that empowers and supports people and is accessible to all. I do have a couple of housekeeping matters just before we get going. So we are expecting people from a wide variety of organisations, both government and community sector. The session is being recorded. As I said before, let me know if you're uncomfortable with that in the chat, and we'll have a think if what we can do about that. We're mainly recording it for our purposes, but we will see if we're able to make it available after the session. In terms of questions, because we're expecting quite a lot of people, we'd prefer if you put questions in the chat, and then we will be stopping 3 times during the session, and I will be putting those questions to Taylor during those breaks. So if you could please leave your mics off and just use the chat function, that'd be great. And the last thing is just to let you know that a PDF of the slides is available, and we'll be sending that out to everyone who's registered after the meeting. So is Kate in the room, Taylor? Yeah, great. Okay, good. So first I would like to briefly introduce Taylor Bell, who is our project lead for the 4R Women's Access Project. So Taylor has done the lion's share of interviewing, writing, etc. And she is in fact going to do the majority of the presentation today. But just before we get to that, if I could introduce Kate Allingham, who is EGA's CEO, and Kate would like to just make a few introductory and opening remarks. Thanks.
Thanks, Sally, and good afternoon, everyone. It's so great to see so many people here today. I just wanted to really quickly give you, I'm hoping that most of you will be familiar with Economic Justice Australia, but just to reiterate that we are the peak body for community legal centres that specialise in social security law. Our work is very much based on the casework and expertise of our members, and this is absolutely an example of that. Without our members, we would not have the networks in terms of the consultation. We wouldn't have the evidence-based work and issues and recommendations. So really just wanted to acknowledge that. I also wanted to acknowledge our funders. So this project has been very generously supported by the Snow Foundation and also for the Paul Ramsay Foundation. I can see Sal's on the line there. I'm not sure if we've got anyone here from PRF, but to have that funding is really important for us to be, so many of us struggle between work that is proactive and work that is reactive. And so we're really hoping that this piece of work will be leading really important conversations rather than responding to issues being raised with us by the department. I wanted to also thank the advisory committee that has given a lot of their time to this project. But I also would really like to acknowledge and thank Taylor Bell and Sally Cameron, whose passion and time on this project I'm sure you'll see in the presentation that we're about to see. I will, I think, at the end just talk a little bit about the next steps. There is no doubt that this project is huge. This is the first of 3 reports. There are a lot of recommendations and there's a huge amount of information here. I don't think that a report has been done like this before. It's really important that this is being documented in the way that it has, but we are looking at definitely looking at next steps in terms of advocacy and how to really highlight some of the issues that are being raised and to bring that to the people that need to see it, some of who I think are on this webinar today. So it is really great. We do have quite a few people on here today from DSS and Services Australia. So that is really good to see. But I'll hand over to Taylor. She can tell you all about the report.
Thank you, Kate. Great. So good afternoon, everyone. Today we're going to delve into this first report and we're going to look at a snapshot of the barriers women in regional, rural, remote and very remote Australia are facing when accessing and maintaining social security. First, I'm going to walk you through the methodology of this project and explain how we undertook this project. And then I'm going to walk you through chapter by chapter with time in between for questions. So when we speak about Australia's social security system, we often talk about payment rates and eligibility criteria, but access to social security isn't just about who's eligible on paper. It's about whether the people can actually navigate the systems needed to claim and maintain these entitlements. This report has uncovered significant structural barriers that can at worst effectively exclude women outside of our cities from essential social security, or at the least make access challenging and sometimes distressing. These barriers prevent many women from accessing the support they're legally entitled to and often so desperately need. It's worth noting that reports 2 and 3 in this series focus on more substantive law and policy reform, and you can see the content of those reports laid out in front of you on a slide. Now, at its core, as Kate mentioned, this research was supported by the expertise and decades of experience of EJA's member centres, specialist lawyers, social security lawyers and advocates. Day in, day out, our member centres see the impact of social security policy, law and service delivery on people across Australia, including women in regional, rural, remote and very remote Australia. This project has combined semi-structured interviews with social security lawyers and community service providers, with data analysis obtained from Services Australia and the Administrative Appeals Tribunal, a literature review, and a legal analysis of social security policy, law, and case law. We have an advisory group, as Kate mentioned. Our advisory group is made up of experts in diverse fields relating to social security issues, and these experts have provided guidance and feedback, and we thank them greatly for their time and support. We also partnered with 2 universities to undertake discrete projects attached to this research project: the University of Melbourne's Executive Branch Research Lab and the University of Queensland's Pro Bono Centre provided invaluable support for this project. So we spoke with 160 workers from 96 organisations across Australia. We prioritised a really geographic spread across state and territory jurisdictions, geographic spread across regional, rural, remote and very remote Australia, and are focused on gathering a diversity of focus and specialisations amongst these interviews. We, of course, spoke to social security lawyers in our member centres, but we also spoke to other legal services, family and domestic violence services, community health organisations, disability organisations, Aboriginal community controlled organisations, and many more. We didn't set out with the intention to speak to so many people, but once we started, the interest and overwhelming desire for reform and action was palpable. The people sought us out when they heard we were doing this work. People rallied their communities and networks, and the passion and advocacy we heard from people in these interviews and conversations around this project was impossible to exclude, but also infectious. So throughout the report and this presentation, we're going to use some certain terminology, and I'll give you a quick dictionary now to make it easier. So when we use the term women, this should be taken to mean all people who identify as women regardless of their sex assigned at birth. It's also worth noting that many of the issues explored in this project impact all genders and people in all locations, often including cities. When we use the term 4R, it's generally for ease of speaking, and it's an abbreviation for regional, rural, remote, and very remote Australia, which, as you can see, is quite a mouthful, noting that these areas are not homogenous, incredibly diverse in nature. When we use the term First Nations, we're seeking to recognise that Aboriginal and Torres Strait Islander peoples are the first sovereign peoples of Australia with diverse languages, cultures, and connections to country. While the term First Nations is generic, we're seeking to acknowledge diversity of Aboriginal and Torres Strait Islander people. Now, the first chapter. So our first chapter, and a really key finding of this research, is that access to face-to-face social security services remain absolutely critical for many women in 4R areas. This project found that there's a lack of accessible and appropriate face-to-face services outside of our cities, which creates significant challenges and can leave some women locked out and left behind. Now, I want to very briefly explain what face-to-face social security services can look like for people outside of our cities, and I'll talk you through the main forms. It's just to help put ourselves in the shoes of being outside of our city. So first, your service centres is your classic Centrelink office and what you usually think of as a Centrelink office. There are frontline staff trained in claims and payment eligibility, among other things, and generally there's a hierarchy of support staff and managers in those centres. Next, and more commonly found in 4R areas, are agents and access points. These are hosted by organisations external to Services Australia. They receive some funding to host phones, Wi-Fi, computers, but neither agents nor access points can help people with decisions, claims, or information and advice about social security issues. It's worth noting that there are outreach services that provide face-to-face services in 4R areas, which are namely remote servicing teams, which are travelling groups of Services Australia staff, mobile service centres, big blue trucks that park up in rural towns to act as a service centre for the day, and community partnership specialist offices, which are Services Australia staff like co-located within a community organisation. So when we ask service providers about their clients' typical experience when trying to access face-to-face services with a focus on women's issues, we had some reoccurring and frequently reported issues that came up. We heard that women seeking face-to-face assistance from Services Australia often felt frustrated when they made an effort to visit a service centre and they were directed to a self-service computer terminal or phone in a public waiting area to provide their information and receive advice. Often, these women had made considerable effort to get to the service centre and had arrived with an expectation of human interaction and support. We heard that this was frustrating, disappointing, and sometimes really distressing because women felt the need to interact with the person to explain and resolve their issue. Some services we spoke to reported attending service centres with their clients, who were often women in distress, for example, from a domestic violence refuge, and were also directed to lodge claims and seek assistance from a computer at a service centre. Compounding upon this, we heard that the prevalence of open plan layouts of service centres, and often the first person you see when you enter a service centre being one or more security guards, affected women's access to social security. Services also reported to us negative experience with the frontline staff, such as staff providing unclear, incomplete, or sometimes incorrect information. We also heard there was a perceived lack of connection and understanding of the communities from those frontline staff. As one service provider said to me, and I quote, "It feels like our current Centrelink system is meant for you to give up. So instead of having a window in where you can talk to someone, there's a system of barriers where you can't even have that conversation." Now, other service providers reported a real difficulty accessing interpreters and social workers when face-to-face. Service providers reported that when these services were available, they were really invaluable, but they and their clients struggled to access them when they attended the service centre. When it comes to agents and access points, as noted, largely common in 4R Australia, service providers reported two pretty distinct categories of experience. So the first was that the agent or access point was merely a computer and a phone in the corner of a room. and women that they were working with that needed support to access desperately needed social security payments felt as though they were cast out, which prevented or delayed access to payments. The second set of experiences with agents and access points were community organisations having the burden shifted of accessing social security to them. We heard some communities had staff at their agents and access points who were bending over backwards, well beyond their funded scope, to help women access their social security entitlements. And the effectiveness of agents and access points was dependent on the skills and sometimes the raw determination of individual workers in these organisations. Remote servicing teams and mobile service centres were generally seen as really helpful for the communities they visited, and service providers expressed sentiment that they should come more often and liaise with local services to make the visits more useful. The relatively new Community Partnership Specialist Officer program, there was very few organisations who'd come into contact with these workers. However, of the small amount that had come into contact, they stated the program was quite promising and looked forward to it expanding and continuing. Now, I can't understate that the desire for adequate and accessible face-to-face services was one of the strongest and most consistent findings of this research, and improving face-to-face service was essential for women in 4R areas to access and maintain their social security entitlements. The recommendations in this report contain a roadmap to addressing some of these access issues. Now, before we turn to our questions after this section, I'm going to speak about access to digital and telephone services. So it's no secret that there's a rapid shift towards digital services, and it's increased convenience for many, many people, including some of those accessing the social security system. However, it's also created pretty substantial challenges for many others living, especially those living in 4R Australia. We know from the 2023 Digital Inclusion Index that 2/3 of Australians are experiencing some level of digital exclusion. And people living outside our cities, women, older people with low incomes, and First Nations communities are disproportionately affected by this digital exclusion. And despite these significant rates of digital exclusion across Australia, we're seeing the social security system steadily default to online and phone options with, offline alternatives decreasing. To break up the monotony, I wanted to share a story that illustrates exactly some of the challenges that a default to online cause and need to change, basically. So I want to tell you the story of Susan, whose story was told to me by Claire, who's a social worker in rural Australia. We've obviously changed the names of this story. So Claire, a social worker, is based in a regional town. Part of her job involves travelling to remote farm properties to provide social work services. During one of Claire's visits, Claire meets Susan and John, who are a farming couple. John has been unfortunately diagnosed with a terminal illness and requires full-time care from Susan. Susan can't work because she's providing full-time care. Because of this, they're in pretty dire financial circumstances. This couple had never accessed social security before and were pretty unaware they had any potential entitlements in the social security system. John and Susan's property doesn't have internet connection or mobile phone reception, meaning they have to drive into the closest rural town to make and receive calls and access the internet. When Claire, the social worker, has visited the farm, she's told Susan that she's pretty likely to meet eligibility requirements for the care payment and she should make a claim. Claire's not able to print or download the relevant carer payment forms to bring with her to the farm property because paper forms for this type of payment aren't available. She's looked on the Services Australia website, they're not available, and also as Claire's walked into her service centre in her local regional town to request them, and they're not available. Claire's told the couple that the best option would be to visit the closest town, which had, of course, a Centrelink agent at the local community centre. At the local community centre, Susan and John were set up with an email account, which they didn't have already, they never used email, and MyGov accounts, which they needed in order to apply for carer payment online. Now, Susan and John are pretty uncomfortable with digital systems and can't really understand the digital web of systems associated with the social security system. They weren't able to check their email or MyGov accounts by themselves. The staff at the community centre, who are of course not employed by Services Australia, were unable to help Susan make the claim or provide assistance with their social security issues. So John and Susan went home, not able to make the claim for carer payment. The next time Claire visited Susan and John, they still hadn't been able to claim carer payment, and their financial issues had deeply worsened. They talked together about driving to the closest staffed service Centrelink office, which is in the nearest regional centre about 4 hours away. The travel costs were pretty significant, and John's health wouldn't allow for travelling that distance in a car. So as a final option, Claire advised Susan to drive into town and make a call to Centrelink to try and lodge a claim over the phone. Susan drove into town to make the call. They waited on hold for 2 hours, during which time the automated messages directed them repeatedly to make a claim online. Finally, after a significant delay and abject destitution, they were finally able to lodge a claim for carer payment. Now, Services Australia's shift towards online services does assume that women have access to the internet, an email address they can regularly check, and the capacity to set up a MyGov account with a smartphone and a computer. It also assumes that everyone trusts and knows how to engage with the online world. Service providers told us through this project that women in their communities struggled to access social security because many lived in places without reliable internet or phone connection and didn't have a high level of digital literacy required to navigate the complex web of digital social security services. And also because they either had no or low incomes and couldn't afford the digital devices and associated costs with going on MyGov or Centrelink online. We also heard about some pretty serious privacy and security concerns and functionality issues like documents getting lost in the system. In addition, we also heard that service providers themselves, so as agencies, who play a pretty critical role in supporting women in 4R areas, particularly those experiencing domestic violence, were struggling to contact Services Australia even on behalf of their clients. Economic Justice Australia member centres have access to what's called the Advocates Channel, which is an outcome of the Robodebt Royal Commission, and it provides direct contact between social security lawyers and key Services Australia staff. Other services such as financial counsellors and domestic violence services do not have this. We heard that women's domestic violence services were waiting hours and hours on the phone to help women access critical social security payments, with many women delayed from accessing these payments and casework time in these services eaten up waiting on hold or for responses from Services Australia. So our social security system needs, of course, reliable and accessible digital and phone access. This report offers pretty specific recommendations about how we get started on improving that digital access and phone access. It is, however, apparent that significant resources must be dedicated to improving these systems. In the immediate term, we need alternatives to digital and phone access because we're not currently an equitable, digitally included country, and there are profound digital access inequities for women in 4R areas that can't be overcome just by improving these systems. As a starting point, working with advocates who are working with women in 4R areas, especially those experiencing family and domestic violence, need to be able to access Services Australia without delay and lockout.
Okay, we don't have any questions in the chat, Taylor, so we might keep going. If I can just encourage people, if you do have questions as we go along, to pop them in the chat. And while Taylor catches a breath for 1 second, I thought I was going to ask Taylor, but I might instead just tell people that to make the point that we made a concerted effort to have open-ended questions and to not steer any conversations. So these findings, while they do reflect a lot of our understanding and knowledge, they reflect the priorities of the people we talked to. We allowed them to raise what was most important to them, and that's really how we've come up with this list. Okay, over to you, Taylor, and just keeping to time.
Great, that's surprising but good news. Okay, so the next chapter of this report focuses on proof of identity requirements and processes as a barrier for women in 4R areas accessing their social security entitlements. Now, Proof of identity requirements are undoubtedly necessary requirements to make sure payments go to the right person and people's information is secure. Not only that, it's crucial to protect the integrity of the social security system. That's undeniable. However, an unintended consequence of these processes mean that some cohorts of women in vulnerable circumstances are delayed or locked out from accessing essential social security payments. Like this quote here from a service provider in rural Queensland, we heard of many, many similar experiences. So at a policy level, we know that Services Australia maintains that a lack of proof of identity documents should never be the reason a person can't get a social security payment. There are alternative identity processes that are available, and recognise that not everyone has the filing cabinet of identity documents. Some of these alternative identity processes include identity review periods where you're given a little bit of extra time to gather your documents. Some groups of people have specific alternative forms, and there are also some admittedly innovative programs that recognise that providing ID shouldn't be an issue when applying for Social Security. That being said, we did hear consistently from service providers that proof of identity is still an issue for women in 4R areas trying to get access to their Social Security entitlements. We heard from service providers about women who were turned away or told to submit documents they didn't have and which were difficult or absolutely impossible to obtain. This was largely due to alternative identity processes not being consistently applied by frontline staff. Service providers reported to us that when a woman didn't have standard proof of identity documents like a birth certificate or a driver's license, then Services Australia staff were not regularly offering alternative processes in a proactive and flexible approach. We heard this was most likely to impact people, women experiencing family and domestic violence who didn't have access to their standard documents. First Nations women, transgender women, young women, and women recently released from prison. This was leading to significant delays in these cohorts of women receiving crucial payments, and sometimes this was the difference between leaving a family and domestic violence circumstance at home and staying. We heard that community service providers were also shouldering the burden of helping these women apply for birth certificates and proof of identity documents in order to access basic social security payments. We also heard that many community service providers were unaware themselves of alternative identity processes, which really aligned with the really distinct lack of publicly available information on alternative identity processes. The recommendations relating to proof of identity in this report substantially relating to improving the service delivery aspect of this requirement. The report recommends Services Australia take a more proactive and flexible approach to this issue, making sure frontline staff are competent and trained in alternative identity processes, and there's better resources and information for community services about these, and that would be a great start. The Social Security Guide also needs updating to make sure women in 4R areas are not locked out by these processes, taking into account a reintegration focused approach to women leaving prison, flexibility for women fleeing domestic and family violence, and a culturally competent process for First Nations women without standard ID. Now, the next chapter of this report relates to access to internal reviews, which are called Authorised Review Officer reviews within Services Australia. We know that Services Australia makes many millions of decisions every year, from pretty simple decisions about, yep, someone has reported their income, to complex eligibility assessments based on a person's generally complex individual circumstances. With a little more than half of all Social Security recipients being women who rely on these payments, it's pretty essential that women in 4R areas have access to reliable and transparent method for review of decisions that they believe are incorrect or unjust. Now, knowledge of the experiences of internal review processes was fairly low amongst non-legal community services we spoke to, and many not classifying Social Security issues as legal issues with a review process attached. Of the Social Security legal services and a small number of other services who understood the administrative law process, Many reported that their clients had challenges with the explanation versus review dichotomy. In the report, there is the story of Mary, who spent over 2 years wrestling with the challenges of this process, only to be told there was no decision to be appealed in the first place, and their debt did not exist, only after repaying it for a 2-year process. We heard from Social Security Legal Services that there are significant delays in the internal review system, with people regularly waiting for 6 to 18 months for a decision. These long delays were leading to what service providers called appeal fatigue, with women just ready to give up. We heard that women were then unwilling to take the next step to the Administrative Review Tribunal because, despite a really high chance of success based on legal advice. Women reported to have said the process was too hard, they're exhausted by the issues with Centrelink and couldn't go more time being in limbo. Some stating that often go without, at times meaning women living in abject poverty. We know that as of the 31st of May last year, 2024, Services Australia only had 195 authorised review officers, and those review officers were dealing with approximately 52,000 outstanding requests for review, with more being lodged every day. When we asked service providers about the decisions their clients received from authorised review officers, with the focus on the experience of women, they told us that the quality of decision making was sometimes compromised by a poor understanding of the situations of women in 4R areas and the limitations of remote servicing. For example, we heard of authorised review officers ignoring or rejecting fairly common aspects of life in 4R areas, even when specific or relevant factors were raised in either written submissions or verbal submissions to these authorised review officers. Examples of factors that were ignored include a limited access to medical services when you live outside of a city, lack of digital connection, limited English language and comprehension, including when women lived in First Nations communities. We also heard that a limited access to community services was rejected or ignored, and also the specifics of family relationships and dynamics in 4R and First Nations communities was also not considered relevant or ignored. So in consideration of the challenges and experience that service providers told us, there are 3 key priority recommendations in this report. The first is that people need to know more about the internal review process. There needs to be increased information and education about the right to seek a review. The second is undoubtedly critical, which is adequately resourcing additional authorised review officers to clear the backlog of review requests and undertake reviews in a timely manner. And also importantly, reviewing the authorised review officer training and quality control measures, including reintroducing geographic and subject matter specialisations, increasing an information flow between the ARROs, the authorised review officers, and the legal branch, and making sure authorised review officers had processes embedded to raise and escalate systemic issues throughout the hierarchy.
Okay, we actually have 3 questions. The first one is, have you seen any changes or improvements in Services Australia's service delivery since they recruited many additional staff?
In terms of hiring more social workers, I've seen an easier, improved access to people walking in and be able to access social workers. But as this project was undertaken over the last year, there's no notable changes. Sally, have you noticed any?
Well, I think that the recruitment of 3,000 additional staff plus 2,000, I believe it was, to kind of take account of staff leaving over the next few years, whatever, to set up a solid block of people who are trained in social security matters. That enormous intake, I think we did immediately notice a difference in claims processing wait times. Of course, it takes a long time to train someone up in Centrelink issues, so I think it will be some time before we really understand how those additional staff, their expertise filters out throughout the system. But yeah, we certainly welcome additional staff, because we know that it's challenging for Services Australia with their limited means to provide the resources that are required to run the social security system well. The next question though, Taylor, is, would access to split screen booked appointments for non-legal advocates to attend Centrelink appointments with their clients be useful for community workers working in areas such as domestic violence and financial counsellors.
Yeah, I've heard this proposal raised before. I think it's a great start. Being able to have like a co-servicing, so you're able to advocate and have your client, the person in distress, with you. I think it's a great solution. It's a good start. I think in conjunction with increasing other access services like face-to-face, I think it's a great start for sure.
Yeah, I think, and people are very reassured if they can see who they're talking to. I think that's a kind of a human element of communication that will make people have more confidence that their matters being taken seriously. The last question I'm going to answer myself, but feel free to chip in, Kate or Taylor, and that is a request to tell everyone more about innovative programs around proof of identity. Are there specific cohorts in particular jurisdictions, etc., and should they be expanded? So this is an area of great interest to Economic Justice Australia, our members, and we have learnt many other community workers. I guess initially the first point is there are provisions that are not necessarily obvious to all community workers that give Centrelink staff some more flexibility to ascertain that just to substantiate that someone is who they say they are. The only point of POI is to prove that the person is who they say they are. So the actual documentation should not be a limitation per se. It's about Centrelink staff having confidence that's the right person. So there are some provisions that provide some flexibility. Our advice to community workers generally who aren't getting that assistance would normally be perhaps to ask for the matter to be dealt with by a social worker who might be able to spend more time assisting the client to access those provisions. Although I know, of course, that shouldn't be necessary. I am aware, I think, of a trial program in Victoria. Don't quote me on this, but I believe there is some work being done through the Community Partnership Project to see whether additional assistance with POI really does help people who are particularly vulnerable to get on payment. And the other two things I want to say is EJA is about to do a fact sheet on this issue. It's not going to come out tomorrow, but we've actually been talking about it this week. We know there's enormous interest, and we know we're aware of many ways POI can be managed that many community workers aren't aware of. So we will produce that. And lastly, we raised this issue with Services Australia's Independent Advisory Board, and we did get really positive feedback from the board and from Services Australia, who've said they are happy to talk with us about how they can assist to provide additional training of EJA members and other community workers in collaboration with EJA, not collaborative training, but us having a bit of a discussion about how we think that might work. And mainly we just think it should be as available to people, to community workers as possible. So that's also another piece of work we're doing in the near future. Yeah. Anything else? All right. Let us move on to the last two chapters of the report.
Great. They were great questions. So the last two chapters of this report relate to access to external reviews and access to Social Security legal assistance. So the Administrative Review Tribunal replaced the Administrative Appeals Tribunal in October 2024. This research was conducted during a period of pretty significant institutional change in this area, with interviews conducted during, of course, the final months of the Administrative Appeals Tribunal. In our view, the observations in this report remain strongly relevant to its successor, the Administrative Review Tribunal. Despite this institutional transition, the structural issues we've identified during this research still continue to limit access to Social Security and the associated rights. This establishment of the Administrative Review Tribunal presents a really great opportunity to address these long-standing issues in our view. Of course, as a notable first step to this, it's really promising to see that the Administrative Review Tribunal has established a registry in Darwin, which is the first and only registry in the Northern Territory. And we really look forward to seeing how improvements to the accessibility of the administrative review system result from this for all people in the Northern Territory. So legal services reported to us throughout this project that when they assist women from 4R areas with external reviews to the tribunal, many have pretty significant accessibility issues. Largely, this is due to the tribunal processes and procedures being predominantly designed for a city context. And the limited tech and poor digital infrastructure in 4R areas prevent, effective servicing, which means that many women are struggling to meaningfully participate in external review processes, including phone and video hearings. In addition to this, we heard that even when women get their foot in the door and they are able to lodge an appeal at the tribunal and receive a decision, we hear that some tribunal decisions fail to properly account for the realities of what it's like living in a 4R area. In the words of one social security legal service, the AAT makes poor decisions in relation to understanding poverty, disadvantage, financial hardship, the cost of living in regional remote areas of Australia, and for Aboriginal clients. It makes poor decisions in relation to understanding that the concept of care in our clients' understanding does not accord with the Anglo-Western definition of care and parenting. Now, with the assistance of students from the University of Melbourne, we reviewed AAT cases that dealt with people from 4R Australia. Overwhelmingly, considering 4R factors was the exception and not the rule. The challenges of living in 4R areas were considered not unique when determining things like special circumstances for a debt waiver. There were more decisions that, ignored accessibility issues like the need to travel long distances for treatment, the need to travel long distances to obtain medical evidence, a lack of employment opportunities in 4R areas, social isolation, and in one instance, that the absence of a post office to post hard copy evidence to the tribunal was an irrelevant factor. This includes further findings from review of these cases that difficulties understanding hearings and evidence and proceedings over the phone were also not considered relevant, which is a pretty strong issue for people living in 4R Australias with digital and phone access issues. There is undoubtedly room to improve the Administrative Review Tribunal for women in 4R areas, if not for everyone. Now, this starts with a comprehensive and accessible resources on administrative review rights from both the Administrative Review Tribunal and Services Australia, and outreach and community engagement forums for this new tribunal. The Administrative Review Tribunal has a pretty great opportunity to start these things on the right path with practice directions for social security matters and a consultation process for people in 4R areas that are designed for their accessibility and their needs. The report also makes specific recommendations for improvement of Department of Social Services and Services Australia to improve their engagement with the tribunal. Now, finally, social security legal services, which are absolutely critical for navigating this incredibly complex system. Social security legal services are chronically underfunded, particularly in 4R areas where service delivery costs are higher and recruitment is more challenging. Finding a lawyer to help you with a legal problem can be a huge problem for women in 4R Australia, let alone finding a lawyer who's funded to help with a tricky social security issue and has that expertise. Now, a small number of legal services specialise in social security advice, information and representation, either working only in that area or incorporating that into a generalist or multidisciplinary practice. These are all EJA member centres. These legal services spend a significant amount of time and resources juggling funding sources just to maintain basic operations. Many piece together budgets from a combination of state and federal grants, one-off project funding, philanthropic grants, and disaster response allocations. Over the years, the impacts of this chronic underfunding have been exacerbated by a generalised increasing demand for legal assistance and things that have undermined the effectiveness of the social security system, like the Robodebt scheme, the impacts of COVID-19, income apportionment, and sometimes problematic IT systems, among other things. People typically present to these social security legal services with multiple interconnected legal issues, requiring a really significant time and expertise. Their legal issues are often really complicated by personal circumstances like mental health issues, family violence, experience of a disability, and require significant support. To drive this point home, I want to share this quote from a Social Security legal service. People are crying on the phone to us for help. There are whole families in Western New South Wales surviving on just one Centrelink payment because carers have given up trying to get carer payment. Young people have given up trying to get youth allowance. People with disability have given up trying to get disability support pension. These people are entitled to Centrelink payments, but they've given up because the social security system is too difficult to navigate. So on that note, the report recommends that the federal government increase funding to EJA member centres through designated social security funding stream, in addition to funding through the Department of Social Services. Australia also needs a national, regional, rural, remote and very remote access to justice strategy and action plan, which considers not just social security, but the full gamut of access to justice issues for people in 4R Australia. Where you live shouldn't determine your access to social security, but it also shouldn't determine your access to justice. On that note, thank you very much for your interest in this work. I'm going to pass on to Sally potentially for some questions and Kate for some closing remarks, but Cynthia, thank you.
There was a question about the Advocates channel in the chat, which has been answered. But basically, if people aren't looking at the chat, just to let you know that the Advocates channel, which EJA members have been using now for, I can't say how long, but it's over a year. And as Taylor said, came through as a result, as a Robodebt Royal Commission recommendation, has been expanded to other community legal centres, women's legal services and Aboriginal legal services. Legal Aid is currently not in that group, nor are other community service providers. We understand from Services Australia, they are looking at other options that are fit for purpose for people working in different community sector, different parts of the community sector, but that we're not a part of that, but we do understand that's a work in progress. The other thing I was just going to say is Taylor Veronica, who works at EJA, and I have all worked in, have all done casework practice in a member centre, in an EJA member centre. And I really cannot emphasise the difference it makes to people's lives, the ability to get social security legal support. So people come with a problem that doesn't seem like a legal problem, but because the system is underpinned by an absolutely enormous, by numerous acts, and at least a couple of them are absolutely enormous, plus there's policy guidance, etc. To get to the bottom of a problem often requires expert and legal expertise. Without it, people are left with no income or with debts that are incorrect or unfair. So funding remains an absolutely critical factor in terms of people being able to access their social security entitlements. I think now I'd like to thank Taylor. Thank you so much for that enormous amount of work and information that you've shared in the short time. And if I could hand over to Kate to make some closing remarks, or if we have time, we'll see if we can get back to questions. So Kate, are you there?
Yes, I'm here. Thank you, Sally, and thank you, Taylor, for that very comprehensive summary. I did just want to acknowledge that Services Australia and DSS are doing quite a bit of work in this space at the moment. We are, seeing some changes, and there's certainly some projects that are being worked on. We also have a lot of people from the department who are here today, and a lot more. I had requests to make sure that this was recorded because there were so many people that were wanting to attend who were going to leave the agency short of staffing, which is a good sign in terms of engagement. I did just want to really encourage people to have a look at this report. There is 119 recommendations, and they are very specific and very carefully considered. So this is just a really brief snapshot summary. And as Taylor said, this is the first of 3 reports. So there is going to be a lot of recommendations for us to work with moving forward. I think it's important to note that while there is a lot happening, like within the agency, in regards to change, that the experience for people on the ground, is still very much what Taylor has depicted within this presentation. And it's important that we are engaging and understanding why that is still happening. I think that things are improving, but obviously this is a huge and complex system, and it's going to take some time for things to filter down. But it's important, I think, that we continue to be talking to, the people that Taylor has talked to for this project, our member centres as well, to be really getting a sense of whether or not those changes are filtering down and making a difference. We are going to be working, and it's great that we now have all of your names so we can get back in touch. We're pulling together some stakeholder groups because we are going to have so many recommendations. It's really important, I think, that as we're considering where to prioritise our advocacy, that we are doing that in lockstep with other advocates. We know that it's really, really hard to get change in the social security system. And so we want to make sure that we are, I guess, united in our priorities moving forward. So we have quite a bit of work to do. We're hoping the second report will be ready sort of towards the end of July, and then the plan is that we'll do quite a significant launch in Parliament once we have all 3 reports. I'm really hoping that the new minister will be part of that process, but obviously we have a bit of work to do in terms of that. I think that there is an agenda in this space at the moment with the current government, and so we're really hoping that this report is very much picked up, and that we are able to actually achieve some real change for some of the most vulnerable women in Australia. So I guess that probably concludes. I'm not sure if anybody wants to comment on that.
There is one more question, Kate. If I could ask it and partly answer it, and then see Taylor or Kate if you want to add. The question is whether government's given an indication that they will investigate non-take-up of payments or people being on an incorrect payment, often at a lower rate. So we are well aware there are many people on Job Seeker who are trying to get disability support pension, which is paid at a higher rate. And we are also well aware that there are many people stuck on the base rate of Family Tax Benefit A because they have not sought child support in an acceptable or in a manner acceptable to Services Australia. Both those issues are going to be addressed in our second report, so it's a good opportunity to pitch that there'll be more content, policy content in that second report. And we are advocating for changes to DSP, and we have asked that there be a review of people stuck on Family Tax Benefit A base rate and the reasons why. And we would in fact like those people to be contacted so that Services Australia can really understand why. And in fact, if something quite simple can be done to get them onto their whatever their full entitlement is. There is some work being done by DSS and Services Australia in that space, and we're waiting to hear really where that's up to. Do you have anything else, Taylor or Kate?
No, I don't. I just wanted to thank everyone sincerely for their interest, and the amount of people that have come and paid attention and engaged with this topic is really great and promising. And I look forward to working with you. This is not the end. It doesn't park on a bookshelf. Continue to work really closely with all of you. And I'm grateful for your time today.
Yes, so I'll reiterate, thank you everyone for attending, and we look forward to being in touch and working with you further. Thanks a lot.